the contents of cavernous sinus, which you already know some of them, and will add more. So do it. See, this question is asking direct content. What is a direct content? Means it is a direct content and not in the wall. So it is not in the wall, and it is a direct content like that. Yes. Then who is in the wall? That we'll find out. But who is a direct content? Direct content, I think the answer should be abducens nerve. Yes, because it is passing through the cavernous sinus. Then what about these? They are in the lateral wall of cavernous sinus. Can we see some diagram? They are in the lateral wall of cavernous sinus. Yes. They are in the lateral wall of cavernous sinus, but this is passing through the cavernous sinus. So that is the answer. Yes. Can we see the diagram then? Yes. We'll draw the diagram also. See this diagram. What is this? I think we have seen this diagram earlier. Yes. Examiner is also showing this diagram, asking you which nerve is here. They'll tell A and B and C and D, and then we will be at loss. We don't know what is happening. So we have to be careful, you know. You have to be careful about what? About nerves, optic nerve, oculomotor nerve, abducens nerve. One question has already come, abducens nerve. Puncturing the durameter at the posterior cranial fossa, you told longest interdural course. Yes. And trochlear nerve. The thinnest cranial nerve. Yes, thinnest. Thickest is trigeminal. Forming some ganglion at the floor of middle cranial fossa. Yes. This is the area which you have to focus upon now. Magnify. Yes. Okay, then magnify. As a magnifying this area, these are the nerves which are related to cavernous sinus. So magnify. As you magnify, you will see now this is the trigeminal nerve and ganglion, where at the floor of the middle cranial fossa. And what is this nerve? This is the optic nerve, optic chiasma. Optic nerve, optic chiasma. Yes. Okay. I think we have discussed that oculomotor nerve is most medial and trochlear is the most lateral. Yes. In the middle was the abducens. If you see a diagram like this. So, this is the oculomotor. Yes. This is the trochlear. Yes. And this is the abducens. Yes. Actually, it is passing in Dorello's canal. What? What is that? Dorello's canal. What is Dorello's canal? What is this? It is PG question. PGI Chandigarh question. Dorello's canal. Yes. You are telling that abducens nerve is puncturing the durameter in the posterior cranial fossa, passing Dorello's canal to enter cavernous sinus now. Yes, enter cavernous sinus, and it's a direct content of cavernous sinus. If it is the direct content, that was the answer. Yes. Can we magnify it now? Yes. Understand, this is cavernous sinus and it is having a lot of contents there. We want to see that and magnify. You have to understand this is internal carotid artery coming outside the cavernous sinus, but first it will be inside the cavernous sinus. So this is internal carotid artery content of cavernous sinus, then it has come outside into the cerebrum. Yes, it has come into the cranial cavity cerebrum, but first it is a content of cavernous sinus surrounded by T1 sympathetic plexus. You remember it is surrounded by T1 sympathetic plexus coming from superior cervical ganglion, the Horner syndrome story. Cavernous sinus pathology, remember? Third order neuron injury, internal carotid artery dissection inside cavernous sinus without loss of sweating on the face, Horner syndrome, all that we have discussed earlier. So you are talking about content of cavernous sinus. Yes, it is internal carotid artery. First it is the content of cavernous sinus, then it will come into the cerebrum and give 5 branches. You know what are the 5 branches of internal carotid artery? You know? Ophthalmic artery, anterior cerebral, middle cerebral, and anterior choroidal and posterior communicating. 5 branches. Anyway, that is a different story. Here the story is which nerves are there. You see, this is abducens nerve and Dorello's canal. It is passing and a direct content of the cavernous sinus. And who is this? This is the oculomotor, 3rd nerve. Then who is this? This is the 4th nerve. And who is this? This is the 6th nerve. So why should I know all this? Because examiner is giving you questions like A. Marker A, marker B, marker C. That's why. Okay. So we take a section now here. Take a section. And when you take a section, it's a diagram we have taken from Harrison Medicine. Why Harrison Medicine? Why not Gray's Anatomy? Because I told you, Gray's Anatomy is changing one thing which we are not very sure of. So you are having doubt with Gray's Anatomy now? Yes. So I'm not following Gray's here, I'm following Harrison Medicine. Okay, follow then. What do you want to know? Actually, this is internal carotid artery surrounded by T1 sympathetic plexus and is the content of the cavernous sinus, which I have to draw a diagram. Surrounded by what? Surrounded by T1 sympathetic plexus coming from superior cervical ganglion. It is followed by some nerve here. Which nerve? Abducens nerve, direct content of cavernous sinus. So you are telling this is the abducens nerve which is the direct content of cavernous sinus? Yes. Now when you say this is the abducens nerve, fine. Where are the other nerves? Actually this internal carotid artery is also a direct content of cavernous sinus. You say internal carotid artery is also a direct content of cavernous sinus. What about these nerves? Number 3, 4, 5, 1, 2. If you say number 3, oculomotor, 4, trochlear, 5, 1, ophthalmic, 5, 2, maxillary nerve. They are in the lateral wall of cavernous sinus. If they are in the lateral wall of cavernous sinus, then where is mandibular nerve? Mandibular nerve is not a content of cavernous sinus. Then what about the maxillary nerve? Maxillary nerve in some people may be outside, but it is inside the cavernous sinus. It may or may not be a content of cavernous sinus, but here it is. So keep it inside if possible. And if it is not possible, take it outside. It depends upon the type of question. Practice more questions. That is the only advice I give to my students. Practice more MCQs. So maxillary nerve is a content of cavernous sinus according to Harrison 20th edition? Yes. But it is outside cavernous sinus according to 41st edition of Gray's Anatomy? Yes. Don't follow Gray's Anatomy here. Follow Harrison. Can we draw this diagram where dura mater is splitting now? Yes. You know dura mater will split in such a way to enclose the dural venous sinus, which is cavernous sinus here, that everything becomes intradural. Who is intradural? The cavernous sinus itself. And a question came. Cavernous sinus is extradural, subdural, intradural or extradural? Your answer is intradural, between the two layers of dura mater. One layer which is following the bone towards the skull is called as the endosteal layer of dura mater. And the one which is following the brain, meninges, and it is called meningeal layer of dura mater. And these two layers, meningeal layer and the endosteal layer, split to enclose the dural venous sinus. Here it is cavernous sinus. Everything what you have discussed is intradural. You mean to say this internal carotid artery and the abducens nerve also? Yes, intradural. Now remember, abducens nerve has the longest intradural course and inferolateral to internal carotid artery. It is abducens nerve which has the longest intradural course and it is inferolateral to internal carotid artery. This is the diagram which we'll draw now. This diagram? Yes. Inferolateral to internal carotid artery? Yes. Okay, then draw the diagram. This is the cavernous sinus. How it has formed? Actually, what happened was, there was this double layer of dura mater, yes, and that double layer of dura mater has split into one layer which is towards the skull. Who is that? That is actually an osteal layer. So if it is the end osteal layer of the dura mater, then what is the other one? Other one is the meningeal layer of the dura mater. So meningeal layer of dura mater, now they have split up, yes. And what is inside? The dural venous sinus, cavernous sinus. So dural venous sinus, cavernous sinus. What is there inside the direct content? Internal carotid artery and surrounded by T1 sympathetic plexus. And what else is there? The nerve which is called abducens nerve. Where is abducens nerve? It is inferolateral to the artery. Inferolateral to the artery. So this artery is internal carotid artery. Yes. And it is surrounded by some T1 sympathetic plexus. Yes, T1 sympathetic plexus. And what about the other nerves? Other nerves, if you want, then they are here. 3, 4, 5, 1, 2. What is 3? Oculomotor. 4, trochlear, phi 1 ophthalmic trigeminal, phi 2 the maxillary trigeminal. Now, maxillary trigeminal. Now, once you have told about these structures at the lateral wall, these are the direct control. And we have discussed earlier that when there is an internal carotid artery dissection, it may damage the T1 sympathetic plexus, leading to Horner syndrome. And that is actually the third order neuron injury. And if it's third order neuron injury, there will be no loss of sweating in the patient. There may be some other features of Horner syndrome, but no loss of sweating. Why? Because sweat pathway is intact. It's already given. This pathway is not meant for sweating. So this kind of discussion we have already discussed earlier, if you remember, Horner syndrome.